Well, welcome everybody. Again, I'm Fran Conaway, and welcome you to this meeting with Dr. Dean Watson. I wanted to let you know that we are recording the session, and we are on speaker view. If you prefer a gallery view, you are free to change to that. Um, this session will last an hour. You will be muted, but I know you'll have a lot of questions, so please use the chat function in order to ask them. Before Dr. Watson begins, I have a message from OLLI member Winnie Schmaling. She wants us to know that Dr. Dean Watson is a board certified specialist in internal medicine. He is Chief Integration Officer at both Tallahassee Memorial Hospital and the Capital Health Plan, a bold, unique position that has greatly benefited both organizations, but especially our community. He has been front and center in our community response to the pandemic, which has spared us the worst so far. That's why the Tallahassee Democrat just named him one of our healthcare heroes and Person of the Year. He will say it was a team effort, and certainly it was and is, but his leadership has been critical. On a personal note, when he says, after working together over my 17 years at TMH, I know him to be a wonderful doctor, teacher, and leader, always kind and generous with his time. We are fortunate to have an hour with his. Okay, now it's your turn, Dr. Watson.
That was unfair because Winnie played me because she knew. Oh my gosh, God love Winnie, and I do. Thank you for those kind words. Most of them are untrue, but we'll go with it. Would you all mind if I took advantage of this and flew back through kind of the state of affairs of COVID in our community and in the U.S. just rapidly, and then we will get to the vaccine conversation, which I know everybody's interested in, but I always think it's important to understand maybe gaining an understanding of where we are and where we're headed with regards to this virus, which has consumed most of our lives, especially here. I'm sitting in TMH right now. It's really consumed our lives on a daily basis and CHP's lives on a daily basis. Is that okay? Or if there's anybody, I'll pull up my slide presentation. If it goes, I promise I'll fly through it. I will make sure you all get the slide deck if you want it, so that if I go too fast, I apologize, and then we'll get to the vaccine conversation. I just appreciate you all taking the time to listen. And if I goof this up, please forgive me, because I'm technically challenged for sure, or technology challenged. And I got to share that, and hold on one second here. Okay. So this is the same slide from the last time we had a conversation. This is a coronavirus update, but we will get to something we didn't get to talk about last time, which is vaccines, and thank goodness for that. And so I'm just going to fly back through just to remind you that really the symptoms of COVID have not changed. They're every symptom you can think of, right? And obviously, when should you report to us in a hospital setting or a clinical setting if you have trouble breathing, persistent chest pain, confusion? You cannot survive your current situation. You need to come in and let us know that, and we'll take good care of you. And I would be a horrible doctor if I didn't remind you that you need to be washing your hands accordingly, and making sure that you're social distancing and you're wearing your mask. All these things are absolutely important, and I know you all are doing that. The three main comorbid conditions that we're seeing that have poor outcomes remain obesity, hypertension, diabetes. There are others that you'll read about in the CDC that make you vulnerable, and we can talk about those a little bit here in a second as well. Just to fly through this rapidly, we have to have a glimmer of hope in something, because this has been quite a journey. As you look at, we're starting the world. This is a world view. Here's the good news. Starting to see a trend down. New cases are trending, and remember, always deaths start to trend about 3 weeks after you see this trend. So you're going to see this little blip, this little downward trend here. It should start coming down with these cases coming down as well. That is a glimmer of hope. We've got to focus on the positive here. In the United States, we're seeing a significant trend down in cases, and that's really a good sign for us. As you look at the deaths in the United States, they're starting to flatten. We hope to see this start to trend down over the next month. Also, a glimmer of hope. This is a lot on a slide, but I only put it on here to show you a couple things. This is the summary of Florida, the state of Florida. Don't have to focus on a lot here, but look at the average age, the median age for people in the state of Florida. that have COVID, that have been diagnosed with COVID, it runs around 40 years of age, and that's going to be important in just a second. The death percentage is about 2% for the state of Florida. We'll talk about that in a second. That's not horrible. But the most important thing to look at when you are focusing on the state in general is, well, what's the distribution of cases? And it really looks like a really smooth, or kind of a bell curve distribution, I should say, for ages. And that's going to be important in a second as well. And I'll remind you of that. Hospitalizations really occur in people that are over 45, but more importantly, in people over 55 of age in the state of Florida. And the deaths really are occurring in 65 and over. And that's why you see us pushing for, in the state of Florida, to vaccinate everybody 65 and over. If we can drive this down, then we're gonna do very well. We're gonna talk about that in a second as well. State of Florida, on average, you know, our positive percentages are not horrible. They're coming down 6, 7, 8%. And in the state of Florida, with regards to daily new cases, again, starting to trend down following the US, the trend, that's a good thing. So state of Florida was climbing, now we're heading down, and you hope to see that the death rate starts to trend with that as well. But before I get to that, I apologize. Hospitalization, why is that important? Well, that's what I do for a living, or part of my job for a living is COVID management, it's hospital management. And I'm happy to say that we're starting to see a trend down in hospitalizations in the state of Florida. That's huge. Why? Well, because we have other things other than COVID that we need to take care of in the state of Florida, or in the world. And when you have a hospital full of COVID, you can't really get to those other things. For example, COVID patients typically will stay in the hospital on average, really over 2 weeks. And that really fills up the hospital. If you have 50 patients in the hospital, that's more like having 150 patients in the hospital, because their length of stay is significant. And that takes up a lot of resources. The trend in fatalities in the state of Florida is flattening. That's good news. We hope to see this trend down. I sound like a weatherman, I know, but it says flattening. We're going to trend it down over the next 3 to 4 weeks. That'll be a good sign. This is that same busy slide I showed you for the state of Florida. And why does Leon County do so well in the state of Florida? Well, we have a younger population. Average age looking here, 28 to 30 is who's being affected. Our death rate in Leon County is 1%. It's half that of the state of Florida. It's actually less than that. It's 0.9%. So we do better. But as you drop down here to all cases, the reason why we do so much better is, one, we have a lot of very intelligent people that live in Leon County. And I mean that. We're a very highly educated community, and we know what we're doing. So 65 and over, all cases, oops, sorry, let me go back, sorry. 65 and over, all cases are low, because people know what they're doing. They're listening to the warnings. It's really these college kids, these younger folks, and I've got 4 kids, 4 daughters, so I'm speaking from experience here, is that a lot of the young folks are affected in Leon County, which is different. Remember what it looked like for the state of Florida. It was a bell curve. Here, it's really, we're driving the more of the cases down to the younger age group. Well, that's a good thing for us, because they're not truly as affected. Hospitalizations are the same for this, like the state of Florida. The older you are, the more likely you are to be hospitalized. And the death rate and those that are affected, hospitalized and then die, really it's into that 65 and above. So when you look at total, you're looking above 80% in Leon County are 65 and above that die from this. That's why we're pushing vaccines for 65 and above. Leon County's percentage positive is lower than the state. That's a good thing. So I know if I'm affected and I'm going to go get tested, I really have a 95, 96% chance that I'm going to be negative in that test. So that's a good thing. And as a reminder, in Leon County, it's 0.9%. It's one of the best in the state with regards to mortality. And you could say, well, that's true, Dean, because we have a lot of young people here, and that's correct. What about Leon County new cases per day? Obviously, we're on our 3rd peak, and it's trending down. So Leon County, we're starting to come back down, and that is a gift to all of us in this community, and especially to all of us in the healthcare community. This is just a busy slide that you can look at if you need something to help you sleep at night. It's just showing you that all the different counties and how many new cases. Leon County is obviously more highly populated than the other counties. Just wanted to show you the trend lines starting to come down. Except you see in January we were peaking. February we're starting to head in the right direction, hopefully. This is a graph to show you 1,000, the cases per 100,000, and we're reasonably in the middle. But again, we're going to be slightly higher because of our college population and our high school kids and those that are out gallivanting and getting with their friends. Just as a quick reminder, I have to put this out there, and I know I beat this to death, but the types of tests that are available, I just want to remind everybody, and I know everyone's getting vaccinated, and I think that's a wonderful thing, and we're about to talk about that. If any of your family members need to get tested, just remember, molecular test, PCR, you'll hear it by different names, that is the gold standard. Antigen test, also known as rapid tests, are not the gold standard. I just want to warn everybody when you go to get tested or if your family goes to get tested and they say, hey, I'm negative, my next question is always, well, what test did you have? Well, I had the rapid test because was it an antigen test? Yes. I don't trust it. If you are symptomatic and you need to be tested, go ahead, that's fine. Get your antigen test. If it comes back negative, you have to have a molecular test. Antigen tests are not good in the symptomatic population. If they come back negative, there can be a lot of false negatives. And we can argue about this and have all kinds of conversations. I will tell you as an organization and with FSU, with the University of Florida, many others, we use molecular tests. That's the gold standard. We do not depend on antigen tests, and we have not depended on those from the beginning of this pandemic. So be careful. Antibody tests are clearly a test to define whether you have antibodies produced. You get a vaccine, we check your antibodies. We're not going to do that. But if we did, it would show that your antibody levels are increasing because they're protective. And that's what the antibody test is for. So the molecular test, the PCR test, is the gold standard and available throughout the community and throughout the US, throughout the world. Antigen tests can be helpful if you're symptomatic and it's positive, that means you have it. All right, so why are we here today? So vaccines, finally we get to talk about something that is positive, and we've been waiting for this, and a lot of good work has been done in this. And last time we did this, or had this conversation, we didn't have as many numbers moving to the right, and hopefully not to the red, right, to the abandoned. A lot of vaccines being worked on, 2 of which are active in the US. A third is about to become approved in the US, and a 4th is right behind it, and we'll talk about those in just a second. Types of vaccines, there are really 5 types of vaccines, and you can read this, but the first 2 are the ones that are coming to market right now. The 4th is a protein-based vaccine that's coming to market, but it doesn't really matter what type of vaccine. The genetic vaccines are new. The mRNA vaccines, which simply are using a vector to enter into your system and manipulate your body to create a protein. I'm sorry, they don't use a vector, they're actually the gene itself. The viral vector uses a virus like an adenovirus, a simple adenovirus that is not going to hurt you, to enter your system, and it allows your body to produce a protein that the antibodies are produced against. And then the protein-based, which is the 4th vaccine that'll be coming about, is simply introducing a protein fragment that mirrors what's on that virus, and then your body creates antibodies directed at that protein. So the cool thing is that the mRNA vaccines that came out that people were nervous about, because we use it in other treatments in the US or in the world, that has never been used for vaccines. Well, amazingly enough, these things are incredible with regards to their immunity in the creation of antibodies. The viral vectors have been used, viral vector vaccines have been used for years, and we'll talk a little bit about that. These are the vaccines that are leading vaccines that are coming out. Some of them are being used in other locations. Obviously, Pfizer, the mRNA vaccine, is one vaccine that we have available in the US. We also have Moderna. We're going to talk about both of these. And then we have right behind those 2, right here, Johnson & Johnson using an adenovirus, that's the AD, to introduce this, introduce the material to make your body produce the spike protein for the coronavirus. So this is fantastic news. And let's talk quickly about the differences in these vaccines. Moderna vaccine is obviously created with the National Institute of Health, and its effectiveness is at 94.5%. So what does that mean? That means that if you get the vaccine, 2 doses, 4 weeks apart, we'll talk about that too, 2 doses, 4 weeks apart, that you are about 94.5% likely to produce antibodies at a level that we would consider to be immune to this virus, right? Just because you're in the 5.5% that it does not reach that level does not mean that you don't have any immunity. You're just not reaching the level that they have determined to be immune. Why do we do 2 doses 4 weeks apart? Well, because that's how the study was designed. You could have said, well, Dean, why didn't you do 2 doses 8 weeks apart or 1 dose and monitor? It's not how the study was designed. And so what they have found with Moderna is that 1 dose, and when they test really at that 4-week interval prior to that next shot, is that about approximately 80% of people have antibody levels that are considered immune. Well, why wouldn't we just go with 1 shot rather than 2 shots? Well, because that's not how the study was designed, right? And so we don't know if 1 shot will allow you to maintain immunity for longer than, and it's an estimate, but for longer than 90 days to 6 months. Nobody knows that because it hasn't been studied. When you have done a study and it's been approved with specific intervals and doses, then that's really the ultimate goal, because that is what has been studied. So that's Moderna. Moderna is 2 doses, 4 weeks apart. Can we get away with delaying the 2nd dose? The answer to that is going to be yes. So if, for example, if we have family members that get their 1st dose, and let's say the government decides that we want to go 1 dose, spread it out for 90 days, 120 days, whatever. There are plenty of studies out there that show that that is fine. And actually, AstraZeneca and others are showing that if we do delay some of their vaccines, that the result is good. So I personally am not concerned about delaying 2nd doses. It's just not a concern. People get very concerned about it because they see this. Well, you did the study, it was 2 doses in 4 weeks apart. I've got to have it at 4 weeks. Exactly, not true. Your body's immune system will react to that 2nd introduction well, and I'm assuming, and never should assume, I understand that, but looking out at 3 months, 4 months, people will do well even if we delay it that long. So it's going to be an interesting journey on this vaccine, or in this vaccine journey. Moderna, excellent vaccine, excellent results. And then you have Pfizer, who also, who actually came out first with an efficacy of 95%. Well, the interesting part is they're going to be the mechanism of these vaccines are the same, so they should have the same efficacy. So that's good news. We should feel comfortable that the studies that they did were good because they both came out with the same result. Pfizer selected an interval of 3 weeks, so 2 doses 3 weeks apart. And again, it's because that's the interval they selected for the study. They could have gone longer, they could have gone shorter. And a lot of this played into how quickly can we get these drugs to market so that we're not extending it to, hey, let's test them or give them a 2nd vaccine at 3 months, 6 months, 9 months. We'd still be waiting for these vaccines to come out. So this has really been helpful to us. Some of the problems I didn't mention to you, because this really doesn't affect you all, it affects us, is storage. So Pfizer and Moderna have significant storage opportunities, right? Pfizer, you have to store in a deep freeze. And that's hard because most physicians don't have this type of storage capacity. Once it thaws, you have a limited time to use that vaccine. Moderna, same thing, you have to deep freeze it, but not as cold as Pfizer. But when Moderna thaws, you have 30 days to use it. The other problem is that in these vaccines is that you have to use, once you puncture that vial, you have to use all of them. So they arrive in units of 5 for Pfizer and units of 10 for Moderna. So think about all that those scheduling opportunities, right? Well, I just punctured the vial and I've got to use it within 6 hours, so I better have 10 people scheduled. That's some of the problems you're seeing us running into, so we don't waste any vaccine. It's not easy. So here comes one that is going to be helpful across the board. And you may look at these numbers and go, well, goodness gracious, if I get a 95 on a test or I get a 72 on a test, well, I got a C or I got an A, which one do I want? Well, it doesn't really work like that. So Johnson & Johnson's coming out and they're going to bring a 1 dose, which is going to be a lifesaver, literally, for us, because it now gives us the opportunity to vaccinate large numbers and not have to worry about figuring out how to schedule them for their second dose and how long to freeze it and where do I have to store it and how do I get 10 doses out of a vial. It's been a journey and a half. Johnson & Johnson is going to come out and they're going to show you that this vaccine, which is 72% effective in the United States, which is important, and it's going to be effective because the outcomes with this Johnson & Johnson vaccine show that, yeah, we may not be 95% effective in getting antibody levels to the point where we would consider it immune, but here's what we do. We are almost 100% effective in making sure that people aren't hospitalized and getting sick. So it's 72%. It's like the flu vaccine. It's better than the flu vaccine. Flu vaccine is less effective than Johnson & Johnson's vaccine for COVID. It does a great job of reducing hospitalizations, reducing death, reducing severe disease. So if you said, Dean, would you take Johnson & Johnson vaccine? Yeah, I'd take it all day long. Because if I know that I can get this vaccine and I may get a little bit of a cold or something, but I'm not going to be hospitalized, I'm not going to be sick, then I would do it all day long. And the benefit here is also storage, maintenance, and the ability to pull more than one dose out of a vial and not worry about I have to get 10 doses, 15 doses, 6 doses. It's going to be a game changer for us as long as everybody understands the importance of the outcome. Don't look at the efficacy number, look at the importance of the outcome. Am I going to live if I get one of these 3 vaccines? Yes. And am I going to reduce disease in the United States of America? Yes. And can we get back to normal and start to do things that we used to do? The answer is yes. So as soon as this hits the market, and this will hit the market likely in the end of February, beginning of March, maybe earlier, if they're turning in all of their EUA authorization information this week. So we're hopeful that this thing will be available soon. Game changer. So again, data that will probably bore everybody, but I did want to show you in the state of Florida, this is effective a day ago, how many people have been vaccinated. And I really look at first dose vaccinations because, and I forgot to mention Pfizer with 1 dose, what they're finding is 50 to 60% immunity with just 1 dose. And I told you Moderna about 80%, so they function about the same. First doses in the state of Florida, doing a good job, but more importantly, look over here, just real quick at the 65 and above. Very proud of that. This is a great focus for the state of Florida. They were the first to do this. Let's get our 65 and above vaccinated immediately because they are the ones that are affected the most. So even more importantly, let's look at Leon County. Leon County is doing a great job focusing on 65 and over. And let me just say this. When the vaccines arrived in Leon County to many locations, but let's talk about TMH just for a second. That was December 23rd. We had short notice. They told us the week before, hey, vaccines are coming. We don't know when they're going to get there, but be ready. Okay. So the weekend before that, we sat down and developed a distribution model plan. And we said, we don't even know how many we're getting. Are we getting 5 or are we getting 500? Are we getting 5,000? It's planning for a wedding of 2 or 2,000. Okay, so how do you do that? Well, when these vaccines hit, and we knew we got 6,700 vaccines on December 23rd, we distributed from within 2 hours of arrival out to all of our healthcare partners in the community because we wanted to affect everybody so they could affect all of their frontline workers on December 23rd. And then we distributed out to TMH frontline workers. So I want everyone to hear that because you hear all kinds of things in the news, but that's what TMH did with our partners. And since that time, we have developed a distribution model with all of our healthcare partners in the community, all of the providers, Bond, Neighborhood, TPCA, TMHPP, CHP. These are all of our good partners in this community. In Florida State, we've now been able to deliver numerous vaccines through that distribution model and been recognized by the state of Florida, so they continue to funnel vaccines to us. The vaccines are very limited coming into this state. We're talking 266,000 vaccines to the state of Florida a week. Well, we're battling to get more and more of those vaccines to Leon County, and I'll show you the benefit of that in just 2 seconds here. Let me bet. Yeah, I'm going to scare you with that one. Oh, here it is right here. Sorry. Leon County, we have vaccinated in Leon County over 40% of 65 and over in really 3 weeks, to be honest with you. That's 3 to 4 weeks. That's incredible. By the end of this week, over 50% of our 65 and over will have been vaccinated. I think by the end of this month, we will have everybody that wanted to be vaccinated 65 and over. That's incredible. And that's because the distribution model works. And there's more to follow about that, but I just want to toot the horn of this community. An amazing job that they have done working together. And you all should be proud too. I will tell you, the state average was in the 20s. Leon County's 41%. We'll be at 50% by the end of the week. Then, and I know most of you have seen this, Leon County Health Department confirms 2 cases of COVID-19 UK variant in area. It doesn't matter if it's the UK variant or it's whatever variant. Remember, viruses have to mutate to survive. So there are hundreds of variants of the COVID or of the coronavirus. I would tell everybody, and I do tell everybody, this is great to look at. It's great that Claudia Blackburn does a great job monitoring this stuff and getting on top of it and maintaining the safety of the community. This just emphasizes the importance of getting these vaccines out immediately, rapidly, because the quicker we get people vaccinated, the sooner we won't have to worry about things like this. Do these vaccines work against these variants? Yes. Okay, they work against them now, but these viruses are going to work to fight against anything that we build or produce to kill them, just like bacteria do. They're no different. So what about our testing in the community? Does our testing in the community pick up these variants? Yes. And as a matter of fact, we have one of the best testing centers in the country between TMH and FSU. We built a testing center, and Dr. Jonathan Dennis is incredible. If you have never met him or if you do know him, give him kudos, because he has created the most amazing lab in the shortest amount of time to test for COVID. He deserves some type of an award, and I don't know anything about awards, but so don't worry about this. We need to focus on doing what's right, maintaining our distance, maintaining our hand washing, maintaining our mask, and get everybody vaccinated, and we can worry less about variants. The other thing I want to remind you is the mRNA vaccines. The beauty of an mRNA vaccine is they can take the mRNA vaccine rapidly and change its focus. So if a variant occurs and we're like, Moderna's vaccine isn't really working against this variant, they can rapidly change it so it affects the variant. And that's one of the cool things about those vaccines. And then I'll fly through this stuff because this stuff will bore you to tears, because this is what we do in the hospital. We're still using convalescent plasma, using pooled antibodies from those that were infected with COVID. So yes, they still need people to donate plasma if you've been infected. This does help us with some of the hospital length of stay. Remdesivir, same thing, antiviral that we use to reduce hospitalization in the hospital. Make sure if you're on statins do work. They're anti-inflammatory, so if you have hyperlipidemia, high cholesterol, and statin use, that's probably benefited you in the long run. Zinc does work to reduce effects of viral infections, and it works here as well. We use it in the hospital. Monoclonal antibodies, you all read about BAM and others out of Lilly. We do use this. This is becoming a little less effective against some of these viruses as they mutate. And the benefit of monoclonal antibodies, these produced antibodies, if you will, synthetic antibodies, is that it also reduces hospitalization if you get to them early. Melatonin, believe it or not, maybe some benefits. So if you can't sleep and you're worried about COVID, there's a benefit. And anticoagulation is key. What we're seeing is a lot of crazy clotting issues in young people and older people. So this is always a journey. It's amazing. Sometimes they're bleeding, sometimes they're clotting. It's like this juggling act. This virus is just absolutely interesting. And then the lifesaver, honestly, has been dexamethasone, one of the cheapest treatments available. And so we have a specific protocol we use. And if you're if your oxygen saturation, if your level of oxygen is low, we implement some dexamethasone, and folks have done quite well with that. And never forget about your vitamins, vitamin D, and vitamin C, which are the most important. Believe it or not, they have good outcomes studies with regards to those as well. So that was fast, and I apologize for rapid fire, but I am going to drop this down. And then I know there's some questions. I'm going to have to put my glasses on and I'll read through these questions, and then we'll go to others that you may have, or if I put you to sleep, we'll wake you up and see if you have any. So what are the risks involved with socializing with family and friends in the situation where everyone has been vaccinated? and also in the alternative when some people have been vaccinated, others have not. So just as a reminder that if everybody's been vaccinated, and hopefully we'll get there at some point in time, there still is a low percentage of people that will still may get the virus, right, at 4.5 or 5.5 or 5% if you got Moderna and Pfizer. So I always tell people a couple of things. One is there are no studies that have been looked at with regards to carrier state. If I have been vaccinated, does that mean I can or cannot carry this virus in my nostrils or in my lungs or in my sputum? And nobody knows that. The likelihood is low, but it's not been studied, so you can't answer that question. I would tell folks, look, until the CDC calls off masking, calls off social distancing, and calls off all the hand washing activities, which they never will do, we have to continue to work and live like we're at risk. The risk, if everybody's vaccinated, is going to be extremely low. It's going to just be absolutely extremely low. If you're in an environment where somebody has not been vaccinated and you have been, your risk is low. Their risk, I can't answer because we have not looked at any of the carrier state information. You that are vaccinated would be low. Low meaning extremely low. It says, and then this is a personal. We've been invited to fly to California to visit our family and stay with them. We've been fully vaccinated and they have not. What is the risk that we could transmit the virus to them? Again, not known, but it's probably low. Are there any precautions we can take to reduce risk? Not really. So other than what we've talked about. So if you're going to be, even though you're vaccinated, you're still going to do the right thing because it's your family. You're going to wear a mask when you're out socializing. When you're with them, the likelihood of you spreading it to them is going to be extremely low. You're going to wash your hands. You're going to try to social distance. As long as you're with the same folks constantly, the risk is going to be low of you getting it. I just can't tell you if you're a carrier and going to deliver it to them. But again, likely very low. This is a good question. Many people have reported side effects. The other question was good too. Many people have reported side effects after getting the vaccine, particularly after the second dose, and there's a reason for that. We've been told that those side effects show our immune system are working, and that's exactly right. What about those who don't have side effects except for arm pain? Actually, arm pain is a side effect. So great question. Remember, all of the studies showed that people, we were just talking about this before we went on live, as you get older, your immune response is going to be less. So it's not unusual for people over 65 to have less of a response with regards to symptoms. That doesn't mean their antibody production is not as good. It just means that your immune response to that antigen production or to that antibody production to the antigen is not as aggressive as the younger population, but it does not mean you do not have immunity. Arm pain, again, I just want to tell you, is a reaction, so that's actually a good thing. Is our immune system getting, so back to, is our immune system getting full protection? We're 95% sure it is. And they tested everybody over 65, and their antibodies were produced even though they had low symptoms reported. What are the risks to those who have compromised immune system? Is there any concern that the vaccine could trigger an autoimmune response? So yeah, all that was looked at as well. And they're actually those that are immunocompromised are in the vulnerable population that should be vaccinated. It has not generated autoimmune responses of record yet. So everybody we've been vaccinating has been doing well, and all those in the 30,000 plus did well in general in the studies as well. So having an autoimmune disease does not mean you should not get the vaccine. The question also would be, well, what if I'm on steroids and I'm getting a vaccine? Well, you may have a reduced immune response if you're chronically on steroids. If you're acutely on steroids, I always tell folks, look, if you're coming off steroids, wait 10 to 14 days after you stop to get your vaccine, because then you'll have a better response to the vaccine. Regarding second shots, how long can you wait after the first shot to get second shots? Again, we talked a little bit about that. Pfizer is 3 weeks, Moderna is 4 weeks, but spreading it out, which people have talked about and reviewed, you have a few months, if not longer, that you should have the same immune response after that first vaccine. Again, most vaccines that have been studied for booster effect, which is the second shot, show that waiting out months, 3 months, 4 months, and now you have AstraZeneca saying even going out beyond to 6 months, they've seen a great response. It's your body's recognition of that antigen and then producing the antibodies. It's a memory cell, so it's a good thing. It's not gonna lose a memory cell, memory opportunity in months. We have just heard that the UK variant has been found in Leon County, correct? What is the efficacy of current vaccines against variant strains? Good. As of today, we can tell you that the vaccines are still effective against the variants that have been reported. Let's see, when can you get a vaccine after you've had COVID-19? Good question. So the answer to that is that if you had COVID-19 and had symptoms, we're telling folks to wait 14 days after symptoms clear. If you've had COVID-19 and were asymptomatic, meaning that you were tested and it came back positive and you were shocked, you can get the vaccine anytime you want. Now, there are a lot of folks out there that are saying, look, I want to wait till Johnson & Johnson comes out, or I want to wait for whatever. That's fine. CDC will tell you that 90 days after you've had the infection, they're comfortable that you have humoral immunity, you have natural immunity to the COVID without getting a vaccine for at least 90 days. I'm telling you, it's probably even longer than that, 6 months, 9 months. But so if you said, I had COVID, I'm going to wait 90 days, that's okay. We're just telling you that from a clinical standpoint, 14 days after symptoms resolve, if you didn't have symptoms, you can get it whenever you want to get it. Those are all the questions I have, Fran. So
okay. We do have more questions in the chat function, and I'll be happy to let you know what they are. I did want to tell you, and a lot of our OLLI members online know this, that Dr. Jonathan Dennis taught us a couple of classes at FSU. He taught the human biome. And while he was in one of those classes and we were talking about the virus because the class subject switched to the virus, and that's when he started thinking about this new lab and the reagents that he could be using. So we are thrilled for him.
He's incredible. I tease him because I told him he was my person of the year. I mean, I just can't say enough good things about him.
Good. Okay, here's first question. If you have had both vaccines, can it be determined if you had COVID, or are the antibodies the same for COVID and the vaccine?
Yeah, wow. You know what? Excellent question. And unfortunately, the antibodies would be the antibodies. Yeah, you would have to have been tested prior. And we can talk about specifics, IgM and IgG, but the antibodies later are going to be the same.
Okay. And it is also said that people who have had the virus and then get the vaccine sometimes have a bigger reaction to them.
Yeah. Yeah.
Okay.
But that's okay. I mean, and it's a different type of reaction, and it's a different type of memory for your B cells and your T cells, exposing them to the vaccine versus the virus itself.
How soon after the second vaccine are you safe?
Yeah, so the studies show that after the second vaccine, it's 14 days post second vaccine is when you should have your, I'm careful with this, right? Because who knows when we're safe, but that's when they see the peak of the antibody production.
Okay. Can you compare the effective percentage of these COVID vaccines to regular flu vaccines?
Yeah, so flu vaccine, remember, flu vaccine is going to be probably like COVID vaccine. Every year we're trying to figure out which variant it is, right? So we're always trying to guess the year before. And the flu vaccine is a good year if you can get 50 to 70% efficacy. Typically it's around 50 to 60%. So that's why I'm telling you, Johnson & Johnson is going to be a game changer. As long as it's tolerated, which it should be, it'll be a good addition.
Good. Okay, if you've had the vaccine properly administered and you later get COVID, can you transmit it to others?
Yeah, so you're asking if you have a vaccine and you fall into that 5%, and then you, yes, the answer is yes.
Okay, and can you transmit if you are asymptomatic, but you've been vaccinated?
Yeah, so remember, that's the big question, right? Because everything's been pushed to market rapidly and that wasn't studied. So if you look at other viruses and take COVID out of it, it's going to be a low likelihood of carrier state and transmission across the board if you've been vaccinated. But no one knows that because it'll be studied now moving forward.
Okay. How much melatonin per dose would be helpful?
I would try the lowest. I have to laugh because, like I told you, I have 4 kids and a wife, and we have messed around with melatonin with all of them. 2 of them can't tolerate it. 2 of them can. So I start with the lowest dose that you can tolerate, whether that be 3 milligrams, and that should do you. I don't tolerate it very well. My wife does. I don't know. I mean, start the lowest dose and then titrate to whatever you can tolerate.
Okay. Does getting the second shot in the alternate arm help in any way?
Oh, that's right. I was a wimp, right? So I'm right-handed. I got both on the left arm. It didn't help me. So it hurt both times. So I don't know. It doesn't really make a difference.
Okay. Somebody else wants to know, any idea when ages 55 to 64 will be eligible for vaccines?
Yeah. So what's happening right now is we're going to get 65 and over done. It's going to be interesting in Leon County because we're going to knock this out, and then we're going to have conversations with Secretary of ACA and Secretary of Health in the governor's office to see where we can go next. Just to mention again, I'm talking about TMH and all the and CHP and all the provider partners. We've done such an aggressively good job that now they're asking us to start vaccinating vulnerable populations. Well, here's the thing, is that we're not done with mission critical number 1 yet, and that is 65 and above. But we are trying to focus a little bit on vulnerable populations as well, because I still feel 65 and above is vulnerable. And I think what's going to happen next is we're going to go 65 and above, and then we're going to hit vulnerable populations, which is defined by CDC. And then we're going to start dropping by 10 years, 55 to 65. I think we're probably a month away for Leon County, where you're going to see that happen. I think we're a few months away for the state of Florida to see that happen.
We have another question about vitamins and recommendations, and you've mentioned them, and maybe in the deck that you sent to us, you could give the recommended doses with that.
Yeah, well, I'll tell. Yeah, and so I'm going to be careful on this because if you're already on vitamin D supplements, I'm not telling you to increase those. I'm telling you what we've seen in the literature as a minimum is really 1,000 twice a day of both. That's kind of what we're the safe zone, the benefit zone. That's what I take. But I need vitamin D because of deficiency, age deficiency, and all that. Vitamin C is not going to hurt you. It's water soluble. You're going to pee it out if you don't need it. So 1,000 twice a day or 500 twice a day, if you prefer that, that's okay. In the hospital, we're running about 1,000 twice a day. So those ranges are about what I tell folks if they want to try that. I just don't remember vitamin D is lipid soluble. So I don't want to tell people, hey, take a bunch of vitamin D, because you can get sick from taking extra vitamin D. Your body is not going to get rid of it like vitamin C. So if you're on vitamin D, you're probably good to go. If you've got, remember, the people that didn't do well are people that are vitamin D deficient. That's why we tell people, look, take some vitamin D just in case. If you're on vitamin D, your doctor's watching you and your vitamin D levels are good, you're good to go. Vitamin C, again, is just some preventative. And I take 1,000 twice a day.
Okay, and zinc?
Yeah, zinc. So that's a tricky one because in the hospital, we're using doses that I would not tell you to take. And these doses would light your fire. At home, I always tell folks, if you feel like you're getting sick, I'm not telling you to take it every day. If you feel like you're getting sick or your family that's not been vaccinated, then they can use Cold Ease, follow the instructions. They're 220 milligrams or whatever brand you like. It's 220 milligrams, and they take 2 or 3 of those a day, and they'll be good to go. But we're using doses way above that, and I would not tell you to do that.
Okay, good. When and where can persons under 65 with autoimmune conditions get the vaccine?
Yeah, that's. I knew you were going to ask me that. So here's the kicker. The only places currently in the state of Florida that are allowed to vaccinate vulnerable are hospitals. We don't have the capacity in the hospital to do that, and I'll tell you why. And they weren't thinking about this very well when they said that, because if I vaccinate somebody in the hospital and they're gone in 5 days, well, who's giving them their second shot? And it's not us, because we're a hospital. And so it's been a hard thing to work through. So what we've done is we've tied to our hospital clinics, and we've talked to the state politicians, and they're okay with that. So we have our hospital TMHPP, physician providers, and practices reaching out to their patients when we get vaccines assigned to vulnerable populations. We do not have a bunch of them. We have very few. But as they increase the number of vaccines that come out for vulnerable populations, the providers will be reaching out to the patients that, every day, looking for those patients. So right now, there really isn't a location because there isn't one, and there are not enough vaccines. Over the next few weeks, if we get more vaccines, you will hear more from your providers coming out. And if you have that, just notify your provider that you are on that list, and they will keep you on that list so that when we have vaccines, again, the TPCAs, the CHPs, the primary care providers in the community, other than physician partners, don't have the ability to do this. So they're putting that on the shoulders of the hospital, which is already full of COVID and other things, and we're working through a process to be efficient. But we have so many things we're doing, taking care of sick folks in the hospital. That'll take us a week or two to figure that out.
Okay. Someone says he just had the second Moderna vaccine, and the nurse said a booster for variants would be administered to us in less than a year. Do you agree?
Well, I'd like to know where that nurse is getting her information, because no one has that answer. The thought is, and remember, the variants will have to be a different vaccine than this vaccine if they're going to adjust the way it's working. People feel that you may be getting a Moderna booster once a year. It may be 2 years. I've read all the studies, and no one has that answer. Everyone has their own opinion, which I appreciate. I would appreciate in the medical field if people would keep their opinions in their pocket unless there's evidence behind it, because it scares people, and that's not fair. So we'll know more over the next 6 months, and everyone just stay tuned for that.
Okay. What's happening in other countries with vaccines?
Yeah, a lot. I mean, and as kind of back to the slides that we were showing, each country is working with Moderna, with Pfizer, AstraZeneca. AstraZeneca is live and in action in UK and other countries. It is not live in the US for various reasons. And Russia has its own, vaccine. There's a lot of activity going on. And remember, when we looked at that first slide, the world slide, the number of positive cases is trending down. And this is a lot of the reason why.
Good. I don't know if you want to answer this one directly or not, but if blood tests show you are very vitamin D deficient, what's the highest safe dosage to raise it?
Oh, dosage. What's the highest, safest dosage? You know what I would do in that one, quite honestly, is if you know your level and you can go to, because I don't want to, I don't know who their doctor is. I don't want to upset anybody. Is there's a website that you can go to that, and I'm blanking on it for a second here, it'll come back to me, endocrinology website, American College of Endocrinology, I think is what it is, that will allow you to go in and put your level, and it will actually tell you how much vitamin D you should be on for replacement. And I would suggest kind of looking at that. Hey, my vitamin D level is X, what's an appropriate replacement? If I give you medical advice now, they may run me out of here, but that's what I would do. And remember, if it's really, really low and you're taking, 1,000 twice a day or a few thousand twice a day for a week, and then 1,000 twice a day the week after that, you're going to be okay. But do use some resources to help. I just don't know your level.
Okay. Is it safe to go for acupuncture if you've been vaccinated and she has not?
So it wouldn't even be acupuncture. It would be, is it safe to go see your whoever, massage therapist, acupuncturist, your physician? The answer is yes, as long as they're following the guidelines, masking, your mask, their mask, and they're washing their hands. As long as that's occurring. Remember, it's that 6 foot rule, and so I don't know how long acupuncture lasts for, but 15 minutes, 6 feet, unmasked, those things are what scare you. But as long as they're masked, following protocols, yeah, you should be okay.
Okay. And someone says my doctor has me on 5,000 a day of vitamin D.
Yeah, it depends on your level. Absolutely. And so I'm an internist, and this is what I did for a living until they dragged me into administration. And so it really truly 5,000 is not going to hurt you. It just depends on your level.
Good. That's the end of the questions in chat. If anyone wants to ask a question, you can unmute yourself.
I think Marge Masterson had a question. She has her hand raised.
Okay, Marge. What's your question? Haven't heard from her.
She's
Okay,
probably waving.
probably. Okay, Marge, unmute yourself. Okay, I don't think we have gotten her. Well, Dr. Watson, we're just about at the end of your time anyway, and this has been an incredibly informative session. It's wonderful to get our own personal questions answered. I do see a hand up there. Marge, do you have something to ask?
Marge, you're muted.
Okay.
Well, I hope some of it was helpful.
Okay, and I do have one more
There,
comment.
okay.
There she
There
is.
you go.
There I am. I've forgotten the question now. But thank you so much.
Oh, yes, ma'am.
And if I think of it, I'll call you.
You can email, or you can send me an email
I'll
to
email
Dr.
you. Okay.
Yep.
Okay, and here's one more that has just come in. I have type O blood and have donated a pint about every 56 days, but I'm always asked if I've recently had a vaccination. If I've had my second Moderna shot, can I still donate good blood?
Absolutely.
Great. Okay, well, again, Dr. Watson, we really appreciate your time, and thank you, OLLI members, for your questions. Please remember to sign up for Sally Carriott's lecture next Wednesday, February 10th at 2 p.m. She's going to be talking about how the emotional aspects of the pandemic have affected us and how to deal with the grief associated with it. And Deborah, did you have something to add?
Dr. Watson, I just want to thank you, and especially for all your efforts in getting the distribution. That's incredible.
It's our pleasure. Tell Sally I said hello. She just had my daughter in her class too.
Oh,
That's wonderful. Good.
she's great.
Thank you
Okay.
again.
Thank you all
Thank
for
you,
taking the
everyone,
time.
for joining
Thank you.
us.
Thank you, Dr.
Fran.
Watson.
Thank you all.
Thanks,
Thank
Fran.
You're welcome. Bye-bye.
Bye, everyone.
Thank you.
Bye.